Welcome to part 3 of Take 5 to Fight COVID, the educational series about COVID-19 vaccines brought to you by the New York State Association of Healthcare Providers, HCP. I'm Carol Dio from HCP's Public Policy team. I'm a pharmacist and certified immunizer here in New York, and in this segment, you'll get an idea of what to expect after you receive your immunization. First, I'd like to explain the difference between side effects and adverse events. All vaccines and medicines, and even foods, can have side effects. Our bodies are very complex, and there's no such thing as a magic bullet. Anything we take in might have expected benefits and might have expected side effects. Kind of like how everyone knows eating beans can cause gas. Gas can be a side effect of eating beans. If beans made someone very sick and stopped their breathing, that would be an adverse event. Very unexpected and very rare. That person won't eat beans again, but the rest of us sure can. We'll talk about those rare events in a bit. The COVID-19 vaccines being given today have expected side effects too, just like other medicines and just like beans. The important thing to know is that the vaccine side effects are mild and temporary. Expected side effects won't cause a lot of harm or kill us. But the COVID-19 virus can cause a lot of harm and can kill us. A cool thing to know with vaccines is that the side effects can be a sign that the vaccine is doing its job, which is to teach our bodies, our immune systems, to recognize the virus as the enemy. Think of a vaccine as a pep rally for your body. So, what are some side effects you might have from your COVID-19 vaccine? Most people reported soreness in their arm after vaccination, so plan on that. Anytime you get a vaccination, a shot, you might have pain where you got the needle. Some shots are more annoying than others. Most people would say a tetanus shot hurts more than a flu shot. And yes, COVID-19 vaccines can cause your arm to ache for a few days. The medicine is wrapped in lipids, tiny pieces of fat. So until that spreads and goes out of your arm, it might be sore and a bit swollen, just like a splinter will hurt until it's removed. This is mild and expected and isn't likely to interfere with your daily life. Up to 1/3 of people complained of fever or chills. Remember, vaccines work by calling your immune system into action and teaching it to recognize the enemy, the virus. When we're sick and we have a fever, it's our immune system, not the virus, that causes the fever. It's the same with vaccines. Chills or fever with a vaccine are your immune system springing into action. It can feel like the immunization made you sick, when really it's the vaccine doing the job of teaching your body about the virus. It's part of the pep rally, and that's a great thing. COVID vaccines cannot give you COVID-19. With these vaccines, the fever may be uncomfortable and might even be higher than 100 degrees. You can take medicine to reduce it if it interferes with your daily life, and know that it shouldn't last longer than a couple of days. A little more than half the people in the vaccine studies had a bad headache or fatigue. About 1/3 of them had body or muscle aches. A small number of people had stomach complaints, like diarrhea. All of these things happen as part of the pep rally. Many different cells work for our immune system. With the help of our blood vessels, these cells travel through the body looking for the enemy. That leads to side effects that seem to have no connection to the shot in the arm we got. Again, this is amazing evidence that our body is reacting to the vaccine exactly as it should, by looking for the intruder and being ready to take it down before it makes us super sick. It's important for you to know about these side effects so you know what to expect and what problems might be unusual. Most of all, it's important to know that these unpleasant side effects following immunization are normal reactions from a healthy immune system. You'll definitely need a second dose of our current vaccines in order to be protected as much as possible from infection. And I'll be honest, these side effects might be worse with that second dose. But remember, a few days of not feeling your best are much, much easier than a lot of days fighting illness or spreading the virus to your families and patients. Be sure to get your second dose. It's super important. And if you don't experience any side effects, it does not mean the vaccine isn't working. We are all very unique, and so are our immune reactions. Remember the beans? They still feed our bodies, even if we don't get gas. Knowledge is power. So now that you know about expected side effects, let's talk a minute about the unexpected. Adverse events from medicines or vaccines, or even foods, are the ones we don't expect. They're rare, and yes, sometimes they can be serious. As of this recording, there have been less than 24 reports of serious adverse events after COVID-19 vaccination. No one died, and only a few were hospitalized. We all need to think about the risks and benefits of our decisions. The risk of spreading COVID-19 is very high right now. The risk of severe illness from infection is high too, and many people die from it. The risk of a serious reaction from these vaccines is very, very low. Nearly 7 million doses have been given in this country. There have been 21 reports of severe allergic reaction. That's a higher rate than we see with flu shots, yes, but it is still very low and is still a much safer decision than going without the protection of immunization. The pandemic is killing 1 in every 1,000 people worldwide. The vaccine has killed 0. The Food and Drug Administration and manufacturers collect information about all medicines and vaccines for a long, long time after they are released to the public. We're doing this with COVID-19 vaccines too. There is even an extra monitoring system for people to report how they feel after receiving these immunizations. It's called vSafe, and it's an app on your phone that will text you every day for 7 days to record any side effects you are having. Watch the next video in this series about monitoring to learn more about vSafe. Always read the vaccine fact sheet before getting any immunization. The COVID-19 fact sheets are available on HCP's website listed on the last slide. Talk with your healthcare provider if you have questions. Remember, most side effects are not serious, dangerous, or life-threatening and will only last a few days. COVID-19 infection certainly can be dangerous and is life-threatening in many people. Choose the benefits of immunization to protect yourself, your loved ones, and your patients. Continue to wash your hands, wear your mask, and watch your distance. And we can all look forward to going back to normal when enough people are vaccinated.